our webinar for today, which is applying for CQC application and preparing yourself for the registered manager interview as well. So today is an interesting webinar because we've got a lot of people from domiciliary care, supported living. We've got some who are opening baby clinics as well. We've got the whole of our dental clients and new clients who are looking to open a dental practice as well. And we would be talking about CQC, one of everybody's worst nightmare. So we're going to be going through that today. So my name is Saba. I'm one of the compliance consultant at Smart Dental and Smart Health Compliance. And today I'll be delivering a webinar on applying for your CQC registration and preparing for the registered manager interview. So without further delay, I am going to start this webinar. I hope you guys are all doing well. It is a lovely afternoon here in London, where we are based. 1 o'clock lunchtime. I hope everybody's got their lunches and everybody's ready to listen to this webinar. So the aim of the webinar.
What that?
I'm just going to.
You don't have your gloves on to unpack that.
Right. What I'm going to do is I'm going to put everybody on mute. If you guys have any questions, please feel free to ask in the chat box. Otherwise, I'm just going to put everyone.
Can't do it every now. I know I've got to do this lot. I wonder if I have to do it.
Right, so we're all on mute now. As I mentioned, if anybody has any questions, please do put them in the chat box and I will answer all the questions for you guys. I have put you on mute. If you do want to unmute yourself, that's absolutely fine. In the end, you can unmute yourself and you can ask any questions that you want to ask. So let's look at the aim of today's webinar, which is to understand the process of applying for CQC application. The learning objectives will be how you apply for the Countersign CQC DBS and how long it takes. Which application form do you need to complete? What is the process of submission and timeline? And preparing for the registered manager interview. So these are the questions that we get asked, I think, billions of times all throughout the day. And being compliance providers, this is something that we specialize in. So the first thing is whether you're opening a domiciliary care or if you're opening a dental practice or any business that has to be registered with the CQC is getting yourself to be the registered manager or the nominated individual. Now, a lot of people think that it's a lot of work and it's really daunting, but this is what we're here for. We make it super easy for you guys so you can actually concentrate on things like business development or like the build work of the dental practice if you're doing the dental practice, or even recruitment. I know with domiciliary care, supported living and any other businesses, recruitment does take over your life and training all your staff members as well. So the last thing you want to do is focus on CQC application. However, it's the first thing that you do need to focus on because there is a big timeline. So when you submit your CQC application, it doesn't get approved straight away. It goes through various different stages with the CQC. Hence why we always recommend all our clients is as soon as you sign a lease or as soon as you get your keys to the premises, please start working on your CQC application. So these will be some of the learning objectives from today's webinar. So the first thing is first, what do you need to do? So if you are planning to open a dental practice, domiciliary care, supported living, any service that has to be registered with the CQC, you need to get a CQC Countersign DBS. Now, a lot of the time we get this question asked by our clients, which DBS is it? If I've got a standard DBS, is it absolutely fine? Do I need an enhanced check? What does it have to do? Where do I have to submit it? How long does it take? So these are all the questions that we regularly get asked by our clients. So first of all, I'm going to tell you how many types of DBS they are. So there's 3 different types of DBS. We've got the standard check, which is the normal standard DBS that I think every single person does. So whether you're working in a retail or you've just started a new job, you are asked to do a standard check. The next one is an enhanced DBS. So some work placements now say they want to see an enhanced DBS. And this is just a bit more in-depth, basically. And then the last one is the enhanced check with the children and adult as well. So depending on whether you are working with children or whether you are working with adults or in an environment where safeguarding can be an issue. So, for example, a lot of the schools, a lot of the colleges, a lot of the universities, teachers and staff members like that do need to do enhanced DBS because they're working with children and adults. Similarly, if you are running any medical or dental or clinical business where you will be seeing a lot of children and vulnerable adults, again, an enhanced check needs to be done. So then what is the difference when it comes to the countersign DBS? So countersign DBS basically is an enhanced DBS, but all your identification documents like your passport, your driving license, or any identification proof is checked by the post office. That's the biggest difference. Now, what people do, or some of our clients do, well, they don't do it when they come to us. They've done it before and then they go, oh my God, Saba, this is the DBS I've got. What do I do now? So what they usually do is they go online, and we've got Google everywhere now, our guru. So they will type in enhanced DBS, right? So all these websites will come, they will apply for the enhanced DBS and they'll be like, oh, but I've already got a DBS. Now that is the wrong DBS, okay? CQC do not want an enhanced DBS, they want an actually countersigned DBS, which is signed by the post office team in order to assure that an identification check has been done. Okay, so if you're applying to be a registered manager or an individual provider, so if you're, for example, opening a brand new, let's say, dental practice or a medical clinic, so you will be a provider because you will be providing that service. So you will be one of the registered managers or the nominated individual. So then you need to complete the CQC countersigned DBS. Okay. The DBS check that supports your application must no longer be more than 12 months. Now, again, let's say you've done a countersigned DBS and you're not ready to be a registered manager. Now, that DBS shouldn't be more than 12 months old, okay, when you are applying for a registration. If it is, you will need to complete a brand new DBS, okay, because the CQC is going to return it back to you. So this is the countersign DBS. The next thing is, who doesn't require a DBS? Again, we get asked a lot of questions. Oh, Saba, do I need to do a DBS? So we get this a lot from people who are registered with the medical or the dental council. So if I've got a GP, for example, or if I've got a dentist, they usually ask me. Now, very recently, this was not the case. So this got changed in September last year, where the CQC said that if you are registered with any of these professional bodies, so for example, the General Dental Council, the General Medical Council, or the General Pharmaceutical Council. Now we've started to get a lot of clients from pharmacies and they ask us, we want to be registered manager as well. So again, if you're registered with the General Pharmaceutical Council, Health or Care Professional Council, Nursing or Midwifery, then you don't need the enhanced DBS. Okay, so you don't need the, CQC countersigned DBS, because once you are submitting your application to any of these professional bodies, you actually do need to do the enhanced DBS and submit it to them. And this is how you get registered. Hence, this is what the CQC are now saying, that if you are registered with these bodies, then you don't need to do the enhanced CQC countersigned DBS. Okay. So what are the common errors when it comes to the DBS? So number one, not selecting children and adult. So a lot of the times when people are filling the forms online, one of the sections says, I can't show it to you right now, but if you are our member for the IOM system or the MediComply system, we have got a video that actually talks you through how to complete a DBS form, because it can be technical. There's a lot of tick boxes that you have to tick. Also, there are lots of sections where you have to select according to being a registered manager. So one of the things that a common error that we get is when people are filling, or when registered managers are completing the countersigned DBS, they don't select their role. So they wouldn't select registered manager, children and adult. They will only select adult. So if that's the case, then basically you can't see children. So if you are going to be seeing children within your clinics, then you need to make sure that you select children and adult. Now, a lot of our clients have ended up doing that. And unfortunately, if you have done that and you do really want to see children, then you have to complete the whole CQC application again. So please do make sure, not the CQC application, sorry, the countersigned CQC forms, you would have to complete them again. Attaching the incorrect documents. So this is another problem that we get a lot. Sometimes people say, well, I don't have a British passport. What do I need to attach? So they actually give you a lot of choice, like biometric testings and things like that. There's loads of different types of documents that you can attach when you are completing. So please make sure that you are attaching those documents with the DBS application. Last but not least, we do get sometimes people asking us that we have got a conviction and what's going to happen. Is that going to show up on our DBS? Is that going to affect our registration with the CQC? Some of the convictions were very minor, some of them were not minor. So what are we going to do? So I get this question asked a lot. Now, the thing with the CQC is, as long as you are open and honest with them, they do take everything into consideration. So, for example, I had a client and she said, well, ages ago, it was like a drink driving conviction that she got. And she was just like, oh, but it will go after 5 years, but it might show up on my DBS. And I just said to her, look, just be very honest. If it comes on your DBS, when we are filling out your CQC application form, we would actually explain to them what happened and how that happened, and that should all be fine. Okay. And it was fine. She did become registered with the CQC. Now, that doesn't mean that if you've got any serious convictions, that should all be fine as well. But I'm just giving you guys a light example. I don't come across a lot of clients who do have conviction on their DBS, but that was, there are some very rare cases. And then we just advise our clients accordingly and submit the application, and then the CQC would have a look at it. Okay. So what is the process? So what do we do? So number one, we have now applied for CQC Countersign DBS, right? So what happens next? You will apply through the CQC website. You would log in and they will send you your login details. You will type that login details, and then it will say that you will get an email to take the original documents to the post office for verification, and then it's all a waiting game. Okay, so you just have to wait. Sometimes it comes back pretty quickly. Recently, all the countersigned DBS that I've submitted, they've actually come back after like 4 or 6 weeks. So they are taking a long time. So you just have to bear with them while they come back. So once your CQC countersigned DBS has come back, the next thing that we would start doing is preparing your CQC registration. So this is, if you are applying for a brand new registration, you will be required to complete 2 application forms. The first application form is the new provider application form, and then the second application form is the new registered manager application form. So looking at their titles, provider meaning it will all be about the service that you will be providing. So that form will cover what are the services you'll be providing, who will be providing them, when will you start the service, how will you make sure that the service you are providing are safe, well-led, effective, so all the key lines of inquiry. So it's quite a lengthy form. It's about 25 to 26 pages long, and it does take a lot of time to do. So if you're super busy and you think, actually, this is quite a lot of hard work, I haven't got time, again, you can get in contact with Smart Dental and Smart Healthcare Compliance, because this is one of the things that we do day in, day out. We go through hundreds of application forms and we help our clients to make sure that they are completed correctly in the first place, so they are not sent back to the client, and then, the whole waiting game and time management. So before applying, you need to have the following in place. Make sure you have your CQC DBS, because they would need the number for the forms. Another very important document is statement of purpose, but we will talk more about documents later on within the webinar. And all the other supporting documents would go with your CQC registration application form. Okay. So let's look at domiciliary care. So domiciliary care, if you're applying for the CQC domiciliary care provider application, you would be required to submit the following document. So number one is your business plan. Now, I get asked this question so many times, that Saba, do you guys help with business plans? Now, we can support you to create your business plan, but business plan is something which is really bespoke to your business. And I can also put a link of an amazing company called Stanford Finance, and what they do is they look at your business plan and they ensure if that business plan is okay, or if you need to. So they basically review business plans. So I can put that link on after we finish the webinar, and you can get in contact with them if you do need your business plan reviewed. But again, this is not something that we do. We do not make the business plan for you. We can just support you in that and recommend you to somebody else who can have a look and make sure it's the correct one. The next thing is governance policy. So this is basically a policy around how you would ensure that your practice or your clinic is all up to date. What are the things that you're going to be putting in place? Infection control policy, medicine management policy, safeguarding policy, statement of purpose. We've got safeguarding policy and consent policy. So these are all the documents that you need to attach with the CQC application form. Again, we get a lot of clients from various different sectors saying, Saba, where do we get these policies from? And sometimes it's really heartbreaking that they've ended up spending thousands of pounds just to gain these policies. Number one, wherever you're getting your policies from, they have to be customized according to your business. You can't get the policies and just send that to the CQC, because the CQC do read your policies. And this is what I tell my clients day in, day out, that policies are read. So make sure that they make sense to you. Make sure you are aware what's in your policies, because this is going to come up on the registered manager interview questions, and then you're not going to know what it is written because you've just forwarded some generic policies. Also, please don't go out there and pay somebody. I had a client who paid £1,000 per policy. Seriously, I was absolutely shocked. I don't know how people can charge that amount of money. So please be very careful before you are committing to, that type of financial commitments. You shouldn't be paying £1,000 for policies. Again, we've got a MediComply system, which is absolutely great. It has over 120 policies, which are totally customizable according to your business needs. And what we also do is, when you do sign up to our software, we do the onboarding with you, where we will help you to create these policies according to your business needs and according to your business standards. Okay, so please be careful with your policies and make sure they are up to date as well. The next thing we're going to look at is a dental practice. So a lot of our clients, again, are from dental practices. So if you're applying for the CQC dental practice provider application, you will be required to submit the following documents. So number one is your building completion certificate. Okay, so this is a certificate where a building inspector or a surveyor will come in. They will inspect the building before the work starts. So if you're opening, for example, a squat practice, they would come in day one or day two. They'll have a look at your plans. They'll okay the plans. They will tell you, actually, you haven't got a disabled toilet. So what are you going to do about this? So they look at everything. And once the whole build work is completed, the surveyor will come in again and they will sign you all off. Okay. Then we've got the complaints policy, consent policy, financial viability forms. So financial viability statement is a statement that you would get signed from an accountant, and that basically ensures that you have got enough funds in order to keep that practice up and running, or in order for that business to be financially viable, okay, and you're not going to become bankrupt. So this is something that is required if you are opening a private dental practice, okay. Then we've got a governance policy, health and safety executive registration. So because a dental practice uses radiographs, they need to be registered with the health and safety executives. Okay, so we need to make sure that that registration is done. Again, if you are our ION member, we have got a video on the dashboard that shows you how you can apply for a registration. I think it costs about £39 per site, and you can register all your radiation equipment there. The next is the infection control policy. Then we've got the ICO, which is the Information Commission Office. So ICO basically ensures, because we are dealing with patient data, so we will make sure that we are keeping that data safe. List of all the risk assessments that you're going to be carrying out. So that would be fire, your Legionella, your health and safety, your disability, medicine management policy, your organization structure. So this is another one where a lot of people ask me, Saba, what do they mean by organization structure? Organization structure is who's going to be the clinical lead, who's going to be the dental nurse, who's going to be your receptionist, who's going to be your practice manager. So the names and who it is. Now, a lot of the time when you are opening a squat, you might not have the right team straight away. So you might be building your team. So again, you can put in the organization structure TBC, to be confirmed, who's going to be your nurse. Okay. Planning permission. So planning permission is another one. And I hope you all know what planning permission is. Basically, if you're, getting a site and you don't have the E license, I forgot now, was it E1 or E2? So if you don't have the E license, then you need to get the planning permission from the local council. So make sure you have that. Then we've got the public and employer liability insurance. And public and employer liability insurance, again, you can take that out with there's so many companies out there. Quality assurance policies. Then we've got the statement of purpose as well. So as you could see, dental practice compared to domiciliary or supporting living, there's a lot of documents that you are required to submit to the CQC. So sometimes it can be a very daunting process, especially like, list of risk assessments and things like that, where you're not sure of. Even staff training matrix, again, that's a very long and tedious tasks as well. So I will always say outsource these things if you can, because it will help you to save time and it will help you to save the stress as well. So you can focus on business development. Okay. Moving on. So here I'm talking again about references and financial viability, because that's something that a lot of our clients ask about. So individual providers need to supply details of employment history. So yes, unfortunately, you have to go all the way back to the age of 18 and tell us what you done from the age of 18 till where you are now. So sometimes a lot of people have taken like career breaks, or especially like females, they've had a baby, or you've moved different countries and things like that. You need to put a reason why you took that career break. Okay. So you can't just put, right, in 2009 till 2012, I wasn't working. Okay. Let's say you were going to university, or let's say you were doing something else. You need to give a proper explanation, because then what they do is they get back to you. And this is for domiciliary care as well, by the way, or supported living, or pharmaceutical, or any other clinics who are applying for registration. You do need to provide them why there is a gap in your employment history. All right. GP name and contact details, last employer's name and contact details, and declaration that you're medically fit to be a registered manager. So obviously when you provide your GP details, this forms part of the declaration as well. And if you are registered with the GDC, they do get you to sign a declaration for medical fitness as well. So these are some of the things that need to go with your CQC application form. So please do make sure that you have access to them. So the other question is nominated individual. So when you're applying for the CQC application, there's two key roles. So you've got the registered manager, and then you've got the nominated individual. The nominated individual is the person who is in charge of the CQC regulatory activity when the registered manager is away. So for example, let's say you've got a registered manager and they're gone on maternity leave, or God forbid, they've been involved in an accident and they're not available for a month. Okay, so it has to be 30 days. You need to let the CQC know. All right. So that forms part of your statutory notification, again, which we will have a look at a bit later on during the webinar. So then the nominated individual will step in and they will take over the regulatory activities and ensure that the clinic or the care service is running absolutely fine. Okay. So that person is a very key role as well. Now, a lot of the time people go, but Sabah, I don't have a nominated individual. Can I be the registered manager and a nominated individual? That's absolutely correct. You can be the registered manager and the nominated individual. And 99% of the time, that's what our clients do. However, I would suggest that if you have got someone, let them be a nominated individual, because what that does is at the time of the registered manager interview, you're not going to be bombarded with all the questions. They are going to ask the nominated individual some questions as well. So again, it's a good thing to have two people if you can. All right. Then we move over to timeline. So once the application has been submitted, a lot of the people start calling us and asking us, Sabah, how long is it going to take? Where are we now? When do they get back? How much notice would we be provided? So CQC application take anywhere between 16 to 18 weeks, guys. So this is why I always emphasize to our clients, please, when you get the keys or when you are signing the lease, start your application. Okay. It is a lengthy process. It does take a lot of time. So make sure you start the process as soon as possible. Okay. Now, what happens in the end of CQC? They receive your application, and then there's a team that goes through your application. Then they forward it onto a quality team. Then they forward it onto a registration inspector, and then you get an interview. So they've got their own series that they follow as well, right? So this is why it takes a very long time. Now, at any point, they can send your application back and say, we can't accept it due to XYZ reason. And a lot of time that does happen. So please don't get stressed out if that happens. They will send your application back. Once they've sent the application back, they will ask you what supporting documents they would need or what they need from you in order to progress with the application. So please, please, please don't get worried if they have returned your application. All right. Preparing for the registered manager interview. Now, again, if you are doing your CQC application with us, one of the things that we include in our service is we do 3 mock interview questions with you or interviews with you. And during those interviews, we ensure that you have enough confidence and you are fully aware of what the answers are so you don't fail your registered manager interview. Okay. Now, the actual interview usually lasts 4 to 5 hours. Our mock interview also lasts about 4 hours. We try to make them as similar as possible to the actual interviews. It's divided into 2 parts. So depending on whether you're doing domiciliary, pharmaceutical or clinical or GP clinics, or if it's a dental practice, the first part of the interview is usually talks about, the application. So they will ask you questions about the application. So please make sure you have your application in front of you. Okay. Or if you've done it through the portal, so there's 2 ways to do the application. You could do it through the CQC portal, which is the best way, guys. And you could do the actual forms as well, which is a bit more lengthier. So make sure whether it's the portal or whether you've submitted the paper copies, you have got them in front of you. Okay. So once you have them in front of you, they will ask you questions that what are the regulatory activities that you would be providing? Now, that's one of the third questions you will get asked. And that's the question that nobody remembers because they're filling out the application and then they totally forget about it. So please make sure you know what regulatory activities you are providing. All right. Because that would be one of the main questions that they would ask. Another question they ask is, are you aware of the statutory notification? Now, what people don't really revise or they don't really look at is the CQC website, right? There's so much information on the CQC website about the statutory notifications. But I'm also telling you today, statutory notifications are notifications where you have to inform the CQC if anything has gone wrong. So, for example, if there's been a fire, if there's been a flood, or if there's been a death within the dental practice, or you've had to close your practice down for some reason. So these are statutory notifications that the CQC would ask you, and they will actually tell you to name at least 5 to 6 statutory notification. So make sure you are fully aware what they are. The second part of the interview is about you. So what makes you competent to carry out this role? What qualifications do you have? And again, a lot of time people do ask me, Saba, do we need a level 5 in leadership and management? Do we need a level 3? What type of qualification do we need to be a registered manager? Now, the most difficult thing is CQC do not tell you that this is what you need. Like you need a level 4 or you need a level 5 or level 6. What they are trying to see is whether you are competent enough to carry out your role as a registered manager. Okay. So whether you're fully aware that if there's a safeguarding issue, you would know how to deal with it, right? If there is a complaint, you will know how to deal with that complaint and what would be the timely manner that you will be dealing with that complaint. Okay. So it's all about how you are dealing with situations in a day-to-day basic within a clinic. All right. So another example is if somebody comes to you, like a patient comes to you and complains about the clinician or complains about the service, how are you going to deal with it? What is the time frame that you're going to deal with that? Okay. If you have a patient that has got mental capacity issues, you as a manager, do you know how to deal with that patient? Because, for example, if a staff member doesn't know how to deal with it, then obviously you would have to step in. Are you aware of your recruitment policies and procedures? So when you're recruiting your team, on what basis are you recruiting them? Are you recruiting them on their achievements, their qualifications, their clinical experience, their non-clinical experience? So the second part of interview is all about scenario based and how you would be dealing with those situations. So again, my golden tip for the second part of the interview is please, please, please go back to the CPD courses. So complete CPD courses such as mental capacity, clinic competency, consent CPDs, because these CPDs will also need to be attached with your application. Okay. And go back to the CPDs, complete your CPDs, make notes, so you are fully aware how to deal with them at the time of the interview. Okay. And then the other thing is, obviously, if you have no experience whatsoever in managerial experience, please get yourself onto some sort of a compliance management course. So Smart Dental and Smart Health Compliance runs a level 4 compliance management course every fortnight on a Wednesday. And this course I have specially designed for registered managers because sometimes they come to me and they're like, Saba, I have no clue about compliance. I just find it so difficult. So then, it gave me that idea of creating a course, being, a tutor and a teacher and a quality assurer. So I can help those registered managers to gain some confidence through knowledge. Okay. So again, if you are interested in our compliance management course, put your name down or give us a shout and that I can send some information to you. But I think it's a really helpful course and it will definitely 100% give you the confidence to be a registered manager and to understand the roles and responsibilities of a registered manager. Now, some of the other questions can be things like consent, right? What are the different type of consent? Do you know how to deal with consent? What would you do in order to ensure that your patients are giving the consent to go ahead with the treatments? So again, as I keep on repeating myself, these are very scenario based questions, and you might know what to do in that situation. Like me, when I'm in that situation where I'm a registered manager and I'm in a clinic, I will know exactly what to do. But because it's a CQC registered manager interview, I might just become really nervous and I might forget what I was going to say. So if that's you, and if that's the case, why don't you download a full guide of our frequently asked question and answers on our website? So both Smart Dental and Smart Health Compliance has resources. And one of our resources is we've created a frequently asked questions by the CQC registered manager, the CQC for the registered manager. And you can download that for free. I will put the link today in our chat box as well. And if you do want more training and if you do want to practice mock interview questions and answers, then again, you can opt for our CQC registered manager interview package as well. Now, another question that I get asked is, Saba, would I be given any notice for the interview? Yes. Usually they will tell you 2 weeks in advance. Now, recently, I've had some cases where CQC have told them 1 week in advance that you're going to have your interview next week. So please make sure that you prepare as early as possible, because what you don't want to do is delay your interview. You can delay it. So if you're not around, let's say if you're on a holiday or if that date doesn't work for you, then you can delay it. That's not a problem. But generally, you get about 1 to 2 weeks notice to prepare yourself. Okay. Right. So once you've had the interview, what would happen next? Another question that I get asked. Once you happen the interview, depending on who the inspector was or how the interview went, they will generally give you a bit of feedback, and you can ask for feedback as well at the interview. So you could say like, how do you think I performed? Do you think there was anything that I need to improve on, or is there any feedback that I can take back home? Okay, so you can ask them that question. And then what would happen is they would generally send you an email, a following up email saying, we had an interview with you, everything all went well, and then we're going to generate a certificate and you will be able to open and start practicing and seeing patients. Okay. Usually 99% of the time, that's the case with all of our clients. but they would follow it up with the email. Now, sometimes what happens is I was just speaking to a client this morning and she said, oh, the inspector done the inspection on Tuesday and now she's gone on a holiday on Wednesday. So what shall I do? So obviously, clearly, I said to her, you have to wait for her to email you and provide you with the evidence that you're officially allowed to open. Please, guys, do not open your clinics or your services before you've had the confirmation email. Okay, it's illegal to carry out any regulatory activities before the CQC have given you the red flag, unless that regulatory activity is not regulated by the CQC. So what do I mean by that? So for example, Botox, fillers, okay? These are some of the things that are not regulated by the CQC. So you can see patients for those, but you wouldn't be able to see them for dental treatments or dental consultations, okay? Similarly with the domiciliary care as well. So you have to wait for that. And then what they will do is they will generally post you a certificate saying you can now open, this is your CQC ID, right? That's the best case scenario. Now, worst case scenario, what would happen if the CQC are not getting back to me and it's been more than 2 weeks? Again, I get this a lot. Please don't start assuming stuff. Maybe there was a backlog of other reports that they need to start doing. You can chase them up and say, hey, dear CQC, it's been 2 weeks. I haven't heard back from you guys. Just wanted to know where we are in terms of my application. Okay, it might take another week, right? Now, generally, if the inspection hasn't gone well or the registered manager interview hasn't gone well, within the 2 weeks, they will say to you, they will say, right, you've got three options. You can either reapply again, withdraw your application, or change your registered manager. So they will give you that options. Now, we get a lot of clients who come to us at that stage. It's too late then. No, I'm just joking. It's never too late. So if that is the case, that's absolutely fine. As I said, give us a shout. We'll sit down. We'll go through the email that the CQC have sent to you. We'll see why they have rejected your application, and we will try to implement any feedback that they've provided and reapply to the CQC. It's never doom and gloom. You can absolutely reapply to CQC. I had a registered manager, and on the day of the interview, she wasn't really feeling well and she was very nervous. So she was like, Sab, I can't do this. And I said, look, just give it your best shot. Worst thing, what would happen is they would reject it. We will reapply and you can have the re-interview again. So there are a couple of different options, again, that we can explore if your CQC registration interview didn't go well, or, if it was rejected. So don't worry about it. That's something that we can handle for you. Just give us a call and we would do that. Okay. So overall, these were some of my top tips about, applying for CQC registration, preparing yourself for the registered manager interview. And one thing I will again like to emphasize, and I think I've done that a lot during today's webinar, is it is a lengthy process. It does take a lot of time. It does take a lot of going back and forth and a lot of supporting documents that is attached to it. It's not a walk in the park and like a normal application, like a passport application form that you're filling out. There's a lot of documents that need to be attached to it. There's lots of customization of documents you need to attach to it, and there's a lot of going back and forth. So if you are not competent in completing your application form, please get in touch with us, and that's something that we can help you with when it comes to the completion. Okay. Other things. So those of you who have joined today's webinar, or anyone who's going to be listening to the recorded webinar, I know that there's so many people out there. We do weekly, sorry, let me rewind again. We do monthly webinars. So the last Thursday of each month, we do monthly webinars for CQC registration manager interview, sharing top tips as well. I'm going to be doing a whole webinar series very, very soon with different guests as well, talking about different elements of CQC and giving you guys a lot more tips. We've also got our YouTube channel. So Smart Dental and Smart Healthcare Compliance have got YouTube channels where we've got more videos. We've also done a lot of role play, and we're going to be doing another role play very, very soon with our secret guest for registered manager interview question and answers, because our last webinar went really viral and we had over 5,000 views. So thank you so much whoever watched that and supported that webinar as well. And last but not least, MediComply and IOM are great compliance softwares with multiple features like CPD, HR, stock, lab management. And if you're really interested, book a demo. Do not pay over £1,000 or hundreds of pounds on your policy. Get in touch with us. Let us give you a demo of the system, show you how it works, and support you in the journey of opening your own clinic or a dental practice, if that's something that you guys are doing. And if you just want to get some advice, just pick up the phone, give us a call. We've got 5, 6 consultants in our office based within London and all around the UK. We're more than happy to give you guys advice on how to complete your CQC application form. We're also launching our Facebook group soon, where we will be sharing, compliance tips and tricks. And those of you who are from a dental background, do come and see us on the 6th and the 7th of October at London XL on stand H20. We're going to be there giving you guys demos of the IOM software as well. So I think I've spoken a lot today, and I don't know if I'm going to have a voice tomorrow after this webinar, but I really enjoyed today's lunchtime webinar and sharing my knowledge, tips and tricks with you guys. I hope you like this webinar. Give us a like, share, thumbs up, any comments. And if you guys have any comments, you can, or if you have any questions, you can unmute your mic and ask away now.
Yeah, that's perfect. That's great. Thank you.
Thank you so much, guys. Let's have a look. Perfect. So I would love you and leave you guys. Have a great afternoon. Enjoy your week, and I shall see you guys in my next webinar episode. Take care. Bye.